Hi, and welcome to Medical Boundaries. In this training, we will explore how to stay in our power when navigating the medical and psychiatric system. There's a long history of the medical system experimenting on black and brown bodies, causing generations of trauma and terror. Broadly, white supremacy and misogyny are the main causes of medical racism, and within that you get the violence and oppression that you can see on the screen. Society elevates the status of medical professionals, so it's really hard to challenge them for any wrongdoing. Science is seen as the ultimate truth, and the intuition of patients about what they need is often ignored. And there's an abhorrent level of racism surrounding the myth that Black people can tolerate more pain, and that's still happening today, leading to Black people being less likely to receive pain relief when they access emergency care. Medical professionals don't receive adequate training, and patient behaviors are pathologized rather than being understood within the context of culture. White saviorism means that professionals will go into interactions thinking that they need to save their patients and that they know what's best. And when Black people try to resist or exercise agency and bodily autonomy, they're met with aggression and hostility. Breaking the cycle of intergenerational medical trauma rests on our ability to set boundaries as much as possible when interacting with the medical system. The boundaries that you set will depend on your needs, the individual situation, and the support that you have available. On the screen, you can find some options that you can think about. You can also implement a mixture of boundaries, such as requesting information before taking medication, accepting or declining treatment, and communicating the needs that you have around your care before, during, and after. Take some time to pause this recording and read through these options. Medical boundaries can save your life and the lives of your loved ones. They can reduce the instances of mental and physical distress and ensure that you get the care that's tailored to your individual needs. Medical boundaries also protect your physical safety and are a practice of bodily autonomy and agency. Accessing the right care early on means that overall your health outcomes will improve and that your level of risk will reduce. Someone shared a story with me of how, when she was in a psychiatric facility, the worst violence that she endured was from a black nurse. These experiences are so devastating due to the betrayal of being harmed by someone who looks like you. And the experiences that black folks have mean that we should look out for each other when navigating white structures. There are many reasons for this behavior, including internalized racism and self-hatred due to white supremacy. And that hatred is sadly taken out on patients. Having boundaries doesn't mean you will be completely safe all the time. And sometimes, even with the best boundaries, harm still takes place. These strategies will help you navigate the medical system with more safety and ease. Doing your own research is a double-edged sword, because while it can be really helpful, it can also trigger health anxiety. Find an advocate, especially when navigating the mental health system, someone who can ensure your needs are being championed. And if you're a trauma survivor, consider having a chaperone when you're being examined, someone who can support you and monitor the situation. In general, Black doctors are more understanding and sympathetic, so you could ask for one, saying that it would make you more comfortable. If it's not urgent care, you could get to know a professional before having a procedure so that you can build trust. And don't be afraid to check and cross-check information by getting a second and third and even fourth opinion. In the cancer journals, Audre Lorde talks about how she was treated when she refused to have reconstruction surgery after breast cancer. This book centers bodily autonomy through a Black feminist lens, over and above the opinion of white male doctors. If you need the support of a chosen ancestor when dealing with the medical profession, you can draw on the courage and the words of Audre Lorde. And this concludes Medical Boundaries. I hope you and your loved ones find the care that you need. See you in the next training.